afternoon, one and all. Our beloved principal, Dr. Surin Jalalpuri, and active and young NSS program officer, Mr. Sanjay Ogare, and other NSS active members who are there here offline, as well as all the participants who are participating in this webinar online. Let me congratulate once again the NSS unit for choosing the topic to discuss about the obesity and its health-related problems. And at the same time, I thank the organizers for giving me an opportunity to spare some of the inputs to the NSS volunteers. The main objective of this is to make you all to understand the medical science behind this obesity-induced health complications, so that you will be able to counsel the public wherever opportunity arises to you, as well as your family members, and most important is you also adopt the certain health fitness techniques to see that your BMI, body mass index, is healthy, so that you will lead a very healthy and peaceful life as the age progresses. Now, let me start with the topic. Obesity is a very oftenly talked matter in the public, in the educated people, as well as in the health field. Everybody knows about it. But nobody or very few people take care of such a condition in their individual health. So, answering, am I obese? And what precaution I need to take to enter myself into the obesity state is always bothers everybody, but usually it is difficult to maintain our BMI within the limit. It is even applicable to me also, or even to any counselor. That's why adopting it and teaching a condition which affects our health are several. One of them is the obesity, like hypertension and diabetes. This is the mother of all these the conditions. So let me start with some of the quotations, people, what they feel about this obesity. Next slide. Yeah, this is the quotation which mention about the diet and the obesity. See, the calorie which is consumed by our diet. As you look at the pyramid, we can see the vegetable and fruit are the one which gives less calorie, but as you go, the calorie goes on increasing. So our pet items in the daily life, least one are the base and the top one are the usually people like it. This is what everybody talk and everybody feel. I see this quote. This talk about obesity and the fitness. That is, in other words, people who do not run or people do not keep themselves active are victim of obesity. You, if at all you come across the people who are suffering from the obesity induced condition at the late age, probably they will counsel you better. You better control your obesity, otherwise you will suffer at the later age. So that's why obesity is considered as a mother of all the disease. Before you become a victim, you take care of it. And this quote shows a type of obesities. In one of my slide, you will see how the obesity or obese people look like, where fat is deposited in the different parts of the body, how our physical appearance changes. So this quote usually reminds the obese people. Let us come to the certain key factors or key facts. What World Health Organization says regarding the mortality of the globe, in the globe, that is the people who die every year of obesity and obesity related co-morbidities, around 4.7 million premature death. Death is inevitable, of course we know that, but death because of age is a different, but premature death is a different. So around 4.5 million death, premature death, are because of the obesity. So if you look at the WHO statistics, that is global burden of disease on the death of the people. So in 2017, 4.7 million is because of the obesity out of other the disease condition. To put, that is, when you compare the death due to the road accident, the death rate of obesity is about 4 times more than the road accident. And we know that HIV and AIDS so much the people scared about, but the death rate due to the obesity is 5 times more than death which is seen in HIV and AIDS in 2017. This is one of the statistics which is latest statistic available. Now coming to the other key factors, looking at this, the WHO has recognized obesity as one of the epidemic. I think now we are all very familiar what is epidemic because of the COVID-19. Epidemic or endemic are some terms which are spoken in the medical field, but now common people also knows that epidemic. That is when more and more throughout the globe, when they try to suffer at sizable number, then that condition or that disease becomes epidemic. So long back, WHO has recognized obesity as one of the epidemic. The reason for this is the growing number of people globally, more than 1 billion, out of adults, 22 million children who are overweight or obese and who suffer co-morbidities or disability due to this condition. Looking at this figure, WHO recognized the obesity as one of the epidemic. Accordingly, it has taken certain steps. The World Health Assembly Declaration in 2004, obesity is considered as one of the important non-communicable diseases. And again, it is addressed in 2011. What they have addressed is a strategy has to be taken on the diet, physical activity, and to maintain the health of the people. So, because of this, the Fit India movement introduced by our Honorable Prime Minister is addressed to this issue only. So, according to this declaration, there should be an awareness globally, regionally, locally to improve the diets and physical activity pattern at the population level to maintain the health of the public. This is an important declaration. So, looking at this declaration and WHO activity, we can understand the grave situation obesity, especially this 30 years, last 30 years, it is been increasing enormously. And previously thought that it is the Western country, America and Europe, are the victim of obesity. Friends, now since developing countries are also the victim of this. The malnutrition previously, because of lack of food, it was addressed, but the malnutrition due to the abundance of food, improper use of the food leads to the obesity. Let us see the certain science which is involved in this obesity. How people define it. WHO defines obesity and overweight. Remember that obesity and overweight, we'll categorize them later, are defined as a, see, it is a disease, remember now. It is not a condition. It is a disease, systemic disease that shows excessive and abnormal accumulation of body fat leading to adverse health effects. That means fat, as we all know, that an important source of energy. When it is present in the body in the healthy state, then it is good. But when it is excessive, especially when it crosses a limit, then it makes a condition, body condition, a disease, and affect the all physiological, the regulations of the body. Let us see in the next slide how it really affected. Usually, there are various ways to measure this obesity based on the fat content of the body. Out of the several measures, that is body mass index calculation, waist circumference, that is WC, and waist to hip circumference ratio, WHR, are the three widely used the parameters to measure whether the person is overweight or obese. But out of this, generally in the public, BMI is used. But in the medical diagnosis, etc., other factors like WC and WHR are considered by the medical expert. So what is this BMI? BMI is very easy to calculate. Anyone sitting at home, person need not to be an expert for this. Any person who able to measure his height and able to measure his weight can calculate this. It is a ratio of body weight in kilogram divided by height in measures squared. That means weight in kg divided by square of the height in meters. So based on this, if you calculate the BMI, let us see how we can define the obesity. So based on the BMI, if the BMI is less than 18.5, it is referred as underweight. It is also a unrequired condition, another malnutrition. When BMI is between more than 18.5 and 24.9, that is below 25, then it is considered as a normal. Then when you cross it more than 24.9, that is 25 and 29.9, that is each 5 BMI change, then it is considered as the overweight, then obesity 1 stage, obesity 2 stage, obesity 3 stage, and severe obesity. So that means in a multiple of 5, we can call ourselves as, if more than 25, overweight, obesity 1, 32, 34.9, and severe obesity 35 and 39.9, and morbid obesity 40 and 49. So remember that usually an individual, unless otherwise it is a hereditary or because of the medical condition, etc., where people enter into the severe obesity. But generally, a normal person, as age progresses, either we become overweight or we try to enter into the obesity. Even in the children, it is enormously increasing now. That's why we have to take care about the children regarding, are they overweight or are they obesity? Are they obese? So looking at this figure, let us see what complications will develop because of this. So usually this obesity induced complications are explained on the base of the energy homeostasis. So if you look at the drivers, that means what caused the obesity, we can explain based on the energy homeostasis of the body. That means energy generated in the body, energy is spent in the body because of the physiological activity, that is a metabolism, or due to the physical activity. So the fundamental cause of the obesity or overweight is an energy imbalance between calories consumed and calorie expenditure or expended. So what the calorie? Calorie means it is the nutrient burnt in the body due to the metabolism and physical activity. That is calorie. We know that out of all the nutrients, three important nutrients, that is carbohydrates, fat, and proteins, are the source of the calories. Out of these three, again, the carbohydrate and fats are the major source of the calories, that is ATPs, which are required for the physical as well as normal physiological activity are generated. And out of these two, again, carbohydrate and fat, fat is a major source of calorie generation. Already you have studied, that is how much the calorie generated when a carbohydrate is undergo a metabolism compared to the fat. Fat generate more calorie compared to the carbohydrate. Already we know it. Next slide. So based on this, the energy balance, always the calorie intake in the form of food, usually it is explained on the basis of the food and the fluid. Except water, any other fluid, we have to see that whether does it add to the calorie apart from the food. So this intake is expended in the two form. One is energy expended for the physical work and basal metabolism. So basal metabolism is usually normal, that is when we are not doing a normal activity. But basal metabolism is different when you are sitting, when you are doing other the mental works, etc. But when you are sleeping, basal metabolism, people say it is a minimum physiological. But apart from that, physical work is another important, the energy expended. And apart from this, the excess calorie is stored in the form of the fat and glycogen in the body. So this is where we have to look into this. That is, when the calorie intake is expended for the physical work and base metabolism, remaining is stored in the body. Stored in the body in the form of fat and glycogen. Definitely it is a normal physiological process. Whenever we do not take a calorie intake, this stored body fat or glycogen is used to meet the physiological as well as physical work energy requirement. The question comes now, to what extent one need to store the body fat and the glycogen? That is very important. So usually it is this, the energy balance is defined in two forms. One is a positive balance. What is positive balance? It is a result of energy intake being higher than the what is consumed, is called as a positive balance. A negative balance is the one where energy intake begins less than the what is consumed. Remember that usually positive balance is the responsible for the obesity. Look at in the next slide. Why positive balance takes place? Positive balance takes place because of the high energy dense foods which are consumed. That is, fat and sugars are usually the one which are lead to the positive energy balance. Second one is the decrease in the physical activity. That means you are not burning your calories as a fuel. So that lead to the decreased the energy consumption, that lead to the positive the energy balance. It can be better explained in the next slide. See, this is the graphical representation. We have to remember, as I told you, out of the carbohydrate and the fat which is stored, but fat is the major primary form of the energy stores in the body. Remember that. Glycogen, which is stored in the muscle and liver, usually is a limited, and it is required for the immediate whenever energy requirement is there. But excess the glucose, when it crosses the glycogen storage, then it get converted into the fat. In the intermediary metabolism, we have studied this. So looking at this graph, look the isocaloric condition where the calorie which is consumed, if it is completely oxidized, then there is no positive energy balance. But when intake is increased above the oxidation, then the excess the energy is stored in the form of lipid. So the second part of the graph shows the lipid storage takes place because of the positive energy balance. It can be further explained. Look at this, the graph, next graph. This graph shows in 4 years, that is 48 months, a small increase in the energy balance daily, how it leads to the weight gain. This is an important situation why the people gain the weight slowly. In the first part of this, you see in the zero, the energy balance and energy the spent. If energy intake is higher than the spend, slowly at 48 months you can see that enormous energy balance is stored in the body, that if you look at the down, the as slowly the fat mass increases more than the lean other body mass. So in other words, the whatever positive energy is stored in the body in the form of fat is stored in the form of fat mass. That's why the weight gain occurs. The simple message is that if the weight is increasing slowly, it is the fat which is excessively deposited in the body. So the person who gains the weight, who becomes the fat, it is stored in the different parts of the body. See, if it is stored above the waist, then it is called as apple-shaped obesity. These are the medical terminology which are used to explain obesity. If it is stored below the waist, in the hips and the thighs, then it is called as a pear-shaped obesity. And the medical literature says that the apple-shaped obesity is affect the health in the form of the co-morbidities, that is diabetes, blood pressure, heart diseases, stroke and cancer. The pear-shaped obesity is having low risk, not risk-free. Remember, low risk compared to the apple-shaped obesity. Okay, next slide. So look at this, the comorbidities which are associated with the obesity. Obesity, type 2 diabetes, hypertension, heart diseases are the all the very well known the conditions people do suffer. They know it very well. And apart from this, there are less known complications or comorbidities are liver diseases, risk of cancer, mood disorder, that is psychological condition, and reproductive disorders. These are the little less known to the public regarding the obesity. Let us see in the next slide why these comorbidities or health risks develop. See, as I told you in the previous slide, the lipid, the adipose tissue, that is which is referred as deposited in the body, becomes an active when it is the storage quantity increases. That means when hypertrophy of adipose tissue takes place, then it becomes an organ of generating the inflammatory modulators. Those are called as a pro-inflammatory molecules. So an inactive lipid becomes an active lipid when it crosses that obese condition. So we call it as a classically activated the adipose tissue. So it generates the inflammatory cytokines, which are usually we call as adipocytokines. And you must have heard now that is in the COVID-19, that is cytokine storm is responsible for the conditions of the COVID patient. See, this is a similar situation. That is, obesity is a pro-inflammatory condition. Remember that. It is a pro-inflammatory condition that leads to the other comorbidities development. Okay. So look at this. An important condition, one of the medical condition which is talked recently in 2-3 decades is a metabolic syndrome or a metabolic disorder. Obesity is the main cause of this metabolic syndrome. So there are other causes for the metabolic syndrome, but more major cause for the metabolic syndrome is the obesity. And because of this metabolic syndrome, the cardiovascular diseases risk increases enormously. And apart from this, the metabolic syndrome, as I have mentioned already, the obesity is an independent risk factor for diabetes mellitus as well as hypertension. Next slide. Let me tell more about what is this metabolic syndrome. Metabolic syndrome, a serious health condition that places an individual at high risk of cardiovascular disease, diabetes, stroke, and atherosclerosis. Like obesity, you cannot measure it physically. Metabolic syndrome has to be measured medically only. That means the diagnosis of metabolic syndrome, whether the person suffers from the metabolic syndrome, is diagnosed by the medical experts only. So in this metabolic syndrome, There are five, the globally metabolic syndrome is considered when the abdominal obesity increases. That is, waist circumference greater than 40 inches in men and 35 inches in women. So that is based on the waist circumferences where abdominal obesity is induced. It is one of the condition for the metabolic syndrome. When a triglyceride level crosses more than 50 milligram, then it becomes one of the state for the metabolic syndrome. Similarly, the high density cholesterol level, when decreases less than 40 milligram in men and 50 in women, then it is the person prone for the metabolic syndrome. And the blood pressure, when it is the crosses systolic more than 130 and diastolic 85 and higher, and when the fasting blood glucose is more than 100 or greater, then when all these five situations meet, then an individual is said to be having a metabolic syndrome. And metabolic syndrome, as I told you, is a high risk condition for the cardiovascular diseases. Of course, this slide is visibility. I'm afraid, but how the metabolic syndrome or how the obesity induces various signaling system in the body. That is, the biochemical and physiological signaling system, how they are activated and lead to the comorbidities. It explains. I'm sorry, the visibility of this is poor. Can you expand it a little more? Yeah, a little more. Yeah. Yeah, that is, see that. That is when the energy calorie intake, that is positive energy balance is there, it leads to the visceral fat storage. Visceral fat storage, what we call it as obesity. Once the obesity is seen, there is a decreased STL and increased LDL that leads to the coronary artery diseases. Then increases the estrogen level and increases cholesterol turnover and excretion, gallstone, cancer risk, and then again lead to the activation of sympathetic system, and because of the increase in the blood pressure, important condition, that is when triglyceride as well as free fatty acid level is increases, it leads to the development of insulin resistance, a very, very important pre-diabetic state, insulin resistance, where you have a sufficient insulin circulating in the plasma, but its activity or its functional physiological activity is reduced. So it leads to the condition what is called as hyperinsulinemia. So this hyperinsulinemia increases sympathetic activity. One sympathetic tone is increased centrally, that leads to the increased metabolic rate, and the as well as the sympathetic flow to the periphery increases the effect on the cardiac efficiency, and the increase in the peripheral the sympathetic tone. So these are all the linked conditions. How and one condition, obesity, how it gives the chance to the all the physiological parameters in the body regulations become abnormal because of the obesity. That's why obesity is referred as a mother of all these comorbidities. Now, after knowing the comorbidities which are associated with this uh, obesity, look at the mortality increases. That is, increased morbidity and mortality associated with obesity. I explained already what are the comorbidities, risk increases. Look at the relationship between the BMI and the mortality risk. It is a J-shaped, you can see. As your BMI increases, the mortality risk increases. And imagine just from 25 to 30, how the mortality rate is increased. So that's why the always people with the obesity are under high risk of mortality. That means their the age, life expectancy get decreases. So because of this obesity, what happens to an individual apart from the comorbidities and mortality? Another important aspect is the health cost. Hope I need not to explain. Most of you have seen the people who are visiting the physician or hospital because of the comorbidities associated with the obesity. So that increases the health cost. Health cost, that is the medical physician expenditure, diagnostic expenditure, and important one is a drug expenditure. So that's why always, if you look at the medical insurance, your medical insurance cost increases as the age increases. Usually, medical insurance will not be given if you are less than 50. Then they say that you undergo a medical examination, and as your medical examination says you are at higher risk, sometimes either it is denied or the health insurance policy EMI increases. The reason, simple reason is that health cost increases. The second one is decreased professional efficiency and productivity. Individual efficiency and productivity usually compromised. Usually, even I have also heard that in corporate sectors, if the people are obese, then they say that they are less efficient. That's why always corporate try to keep their people healthy. The reason is that they are more efficient and they are more productive. We know that corporate always look at the people efficiency and productivity. That's why the if at all we are professionals, we have to see that we have to keep our the BMI well within the reach of us so that we are more efficient and more the productive. And again, quality of life. Always we know that the quality of life is always compromised when the people are either overweight or obese. It is not always, but look at the ratio. The ratio says that the quality of life is always compromised. And another is social stigma. That means always the obese people are looked different and people talk, and because of that there are always the feeling or emotional stigma is associated with an individual. So these are some of the socio-economic consequences of the obesity. So when these all we know it, then why not to see that our BMI is within our limit? Next. Friends, now coming to the last but one slide, that is, we know that now COVID. Is obesity and COVID risk increases? Yes. Now, especially 3 months, the health reports or most of the medical journals have analyzed, and the September and August health report says that the people with obesity are definitely at higher risk compared to the normal individuals. The figure says that the people who are the getting infected, chance of getting infected is 113% more compared to the normal individuals. So that means the people who are entering into the hospital, COVID hospital, are more, who are obese are more compared to the normal individuals. And about 70%, 4% are likely to enter ICU compared to the normal individuals. And 48% more people likely to die. That means the chances of getting infection, chances of severity, and chances of the getting death is increases in obese compared to the normal individuals. Why? The simple reason or the medical reasons are that, since already I have mentioned, obesity is a pro-inflammatory condition. Because of that, the impaired immunity, chronic inflammation, and blood that prone for the clot worsen the severity as well as mortality in the obese people. So, what we talked, obesity is a non-communicable condition. Now see the communicable disease severity is associated with obesity. So, obesity keeps one risk at communicable diseases, as well as it keeps him a risk of becoming a victim for the communicable diseases also. So that's why the obesity need to be controlled, and one need to look always at his BMI periodically to keep himself not to enter into that stage. So what WHO recommends for this? A simple one slide, because the time is getting over now. Overweight and obesity, remember that it is a preventable. It is a preventable except if it is inheritable. Because of certain other medical condition, then there are treatment for that. For the other individuals, it is a preventable. So what steps need to be taken? Look at what you are eating, the content what you are eating. Remember that usually when we stop eating, when our plates are empty. But we never stop eating when our stomach is full. So look at your hunger state and eat the quantity, and also look at the content of what you are eating. So limit the energy intake from the total fats and sugars. So if you have a healthy food habit, see that fruits and vegetables are major part in your daily diet. Along with that, the legumes, whole grains, and nuts, which are the source of the proteins and micronutrients, need to be important component of your food. And engage regularly in a physical activity. So WHO recommends 6 minutes a day for children, and 150 minutes for the adults spread over the a week is minimum physical activity. What I mean is physical activity not related to your the routine work. Other than this, the physical activity minimum need to be there. So it is individual responsible for his own health. So individual responsibility can only have its full effect where people have access to healthy lifestyle. So healthy lifestyle, keeping a BMI, keep you healthy, and especially your health cost. Friends, remember that if you are earning, you need to spend minimum amount on the health cost, especially as the age progresses. So health cost is now enormously increasing, and whatever your savings are there, if they are meant only for the health cost, then your money required for the spending a peaceful life or money required for the other the conditions like travel or the enjoyment will not be left, because the one is immobility because of the comorbidity, and the health cost keeps the one person the rigid to a center. So that's why the for the future health, one need to see that he maintains his the BMI, especially between 30 to 50. That is the age where the BMI goes on increasing. And of course, in the children, it has to be controlled. It is the parents' responsibility to see that their BMI is within the limit. With this, I come to the last slide, that is healthy BMI, a tool for people who want to lead a healthy life and reach their fitness goal. So recently, our Honorable Prime Minister has started the Fit India. In that, there are different the exercises for the different ages also. Please visit that site and download and at least use some of those exercise based on your age to see that you keep a fitness, so that you suffer less from the comorbidities associated with the fat. With this, I come to close up my talk, and I thank for all of you for patient listening, as well as the NSS unit for giving me an opportunity to spare my few views on this topic. Thank you so much.